first thing I would do is I would grab my MAR, my clinics, and my physician's orders to verify and do my first check to make sure what kind of eye drop, what kind of ear drop, how many drops, which eye, which ear, etc. So I would do that, and I would make sure it's right patient, right dose, right drug, right time, and right route. And the next thing I would do is I would go and gather my supplies, which I've already have done. I just have some gloves, I have some hand sanitizer, I have a suppository, and I have my eye drops, and I'm going to also use my ear drops just for demonstration purposes. Alright, next is where I'm going to do my second check. I'm just going to make sure it's, once again, the right drug, with the right patient, the right dose of the drug, the right time, and the right route. And those are all okay on my physician's orders and my cardiac. So I'm going to enter the room, and I'm going to knock, and I'm going to say, "Hi, I'm Katie. I'm here to give you your eye drops, your ear drops, and also a rectal suppository today. If you had any questions, I would check the armband to make sure it was the right patient." This is my third check, my right patient, and if they were alert and oriented, I could ask them their name and their date of birth just to verify. And I'm going to wash my hands. The first thing I'm going to do is the eye drops. So I'm going to wash my hands, and I'm going to don clean gloves. And what I'm going to do is I'm going to just, since they're laying down, I'm going to just let them lay down, and I'm going to have them tilt back their head as far as possible. I'm just going to turn my mannequin here. Alright, and the first thing I would do is I would take a warm washcloth, and I would clean their eyes, make sure it's free of anything, and I would go from the inner to the outer on both sides here. Alright, and then I would take my eye drops, verifying the correct dose, the amount of drops, the eye, and this is for both eyes, one drop in each eye. So what I would do is I would just take my eye, and I would pull the lower lid down, and I would put one drop in each eye, or that eye, and I would hold the lacrimal duct to make sure that it was staying where it was supposed to, and I would do the same in the other eye, pull it down, instill one drop, and then hold the pressure on the lacrimal duct. And I would just make sure my patient tolerated it okay, make sure the drop actually got in the eye, and then I would take off my gloves, and I would be done with my eye drops. Next thing I'm going to do is I'm going to do the ear drops, and I looked at my physician's orders and I saw that it's only the right ear that was affected. So I'm just going to have my patient turn his head so that the affected ear is pointing upwards. And I would wash my hands, and I would get another pair of clean gloves on. And since my patient is an adult, what I would do is I would take the pinna, pull it up and back, and I would just put my eardrops right in there and instill as many as needed. So it would gravity would help it drain down, and then I would apply a cotton ball here to make sure none of it dripped out of the ear. And I would have my patient keep his head to the side for about 5 to 10 minutes just to make sure that it got where it was supposed to. And then I would take off my gloves and wash my hands. And then I would tell him the last thing that I was going to do is give him a rectal suppository. And to do this, your patient, the best position is left sim. So what I would do is I would have my patient roll onto his side and have his right leg come over on top of his left leg, a little bit further ahead to expose the anus. And I would wash my hands, and I would get on one last pair of clean gloves. And what I would do is I would expose only the area needed. And remember, he's over on his sides and left sims. So what I would do is I would grab the suppository, and I have my lubrication on here, and I would get the tip of the suppository covered in lubrication, not to get it on my gloves. It's hard to handle then. And I would lift up the buttocks to expose the anus, and I would insert the suppository towards the umbilicus, and I would go in as far as my index finger could reach. And once it's in, I withdraw my hand so the suppository is still in there, and I would hold the buttock together to
and I would tell my patient to deep breathe until
until the feeling of wanting to expel the suppository has passed. And once it has, I would leave him and I would tell him, try to hold it in for about 20 minutes or as long as possible. And I would give him a call light and I would tell him when the feeling comes to want to have it again, to call me and I would come in. After I did this, I would wash my hands and I would go and I would document for my 6th grade, document the eye drops, the ear drops, the suppository, how the patient tolerated all of these things, and also then I would go back when the patient called to have it done and record those results.